dealt with today. So here she is for our Deuk plasma rhizotomy of the facet joints in her neck on both sides. Hopefully this will help her with her neck pain that she's been experiencing. All right, Anthony, let's share with the audience the how a facet joint causes neck pain. Shot? You can see from our videos that the facet joints, like any joint in your body, well, they can be injured. And when they're injured, over time, that injury to the joint causes degeneration. And joints that degenerate, well, they end up getting arthritis. Oh, a little too much muscle action. Shot? We're getting down to the facet joints right now in order to treat them. So give me just a second. And did we already show the audience how we use the Deuk plasma rhizotomy to treat the facet joints?
No.
Let's do that.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
We're in the process of localizing to where the medial branch of the dorsal ramus is, which runs along the lateral border of the lateral mass. You can see the arthritis there in her neck, and I am working my way down. Shot. She has some arthritis in those facet joints that you could see over there. Shot. Almost done with the left side. Shot. Her head is straight. Shot.
Yeah, that's pretty good.
Good.
Yeah.
Shot. She's just contracting a little bit. No. I'm fine, but she's shot. She's just contracting a little bit. No, I mean, if you want to, you can. A little deeper wouldn't hurt. for me. It's a reflex contraction. What is this armboard here?
Yeah. I can
Sean?
move it for you. Here.
No, it's okay. I can work around it.
Is that better?
It's better. All right, any questions from our audience?
No questions.
Sean? That's fine. Leave her there. Do you have a biz monitor?
No, I can feel what I see.
Sean? Nice. Sean? All right, we've shown our audience how facet joints cause pain. We've shown the audience how we treat them, that pain.
Yes, we have.
Any questions from the audience?
No questions.
All right. We're almost done. Patient is asleep and comfortable at this point. I'm going to move on to the other side. Knife. Shot. Can see some of the arthritis in the facet joint. Jordan, show the audience the arthritis. Yeah, it's a little right above there, that black area. And there, yes, that. So that's right where her X's are. I asked her, let's make an X on your skin right where you're having the worst pain. And that's what she did. She gave me these X marks. And I'm literally going right to the arthritis through the X marks. So she was spot on with her own assessment of where the pain is. So the thing about pain is that localized pain, people can be really good about identifying where it's coming from. Any questions?
No questions.
So the difference between the Deuk plasma rhizotomy and the radiofrequency ablation is that the radiofrequency ablation is a temporary treatment. Shot? Because the pain nerve typically will grow back. And that's your medial branch of the dorsal ramus, grows back over time. Shot? And when it grows back, well, the pain comes back. But the way we do the burning here is the nerves cannot grow back. Because they're damaged permanently beyond repair. Shown? Just about done. 30 seconds. Shot. I have to keep taking pictures because I want to make sure that we're in the right spot. It's really easy to get out of position because you're using the X-ray to guide you. All right, we're done.
Sitting down, please. Thank you.
Thanks for joining us. We'll be back in 2 weeks for more surgical action here at Deuk Spine.
We do have one question.
Sure.
The question is from Azarel on YouTube. How
Right.
does arthritis develop in such a small area like that, causing so much pain?
Great question. So basically, arthritis is inflammation of a joint. And our bodies have hundreds of joints. And these joints can be small, they can be big. If you think about the knee joint is pretty big. It's easy to see. But if you look at your foot, you have like a lot of joints in your foot that are tiny. And injuries to your foot or to your neck can cause joint injury that over time hurts more and more as your body tries to heal that injury through a process called inflammation. It's actually the inflammation that causes the pain. We have to stop the inflammation. And we don't have a way to stop inflammation today. So what we can do is disconnect the pain of those joints from your brain. And that's what we do by doing a medial branch of the dorsal ramus rhizotomy. Great question. Thanks for joining us at Deuk Spine Institute. Let's share with our audience the patient who's had this done. And good morning, I'm Dr. Deukmedjian at the Deuk Spine Institute. I'm here with my patient who traveled to Deuk Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4 millimeters. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then?
Yeah.
Why did you decide to come to Deuk Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
And fusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary, because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck, and it was really bad. I would turn my head anyway, and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research, trying to look for exercises I could do to help my disc, he popped up on my feed and said, "Do you have a herniated disc? I can fix you." And the more research I did, I was just so thrilled, because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it, and I was like, "You're done already?" The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Deuk laser disc repair and the Deuk plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option, because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.